Hi everyone, welcome and welcome back again to this channel. Today we are talking about something that people do but they think that it is not harmful. That is self-medication. Most people have once in a while they have gone to the pharmacy and bought medicine and took them without prescription, without doctor's instruction. I know most of the people, 100%, in fact 100%, once in a while you have done that. Most of the people do that because they think maybe because they have headache, they just need painkiller. Maybe that headache that you are having is not for painkillers. Maybe it is something else, something more harmful, something that can put your life at risk, that can put your health at risk. So I'm going to tell you the dangers of doing self-medication. What you have to know, from painkillers to antibiotics, millions of people take medicine without prescription from the single day. What am I saying even? I'm saying now while people have taken painkillers, people have taken antibiotics and even other drugs every single day without prescription. But what you don't know that what healthcare team is telling us might shock you. What you have to know that self-medication means taking herbs or even supplement without proper guidance. I usually see even people online are selling some supplements like vitamin D, vitamin A, without even any prescription, and people are buying those drugs. It could be using a leftover prescription, buying over the counter drugs, following advice from friends or social medias instead of qualifying healthcare provider giving you prescription. Is where it gets dangerous. Diagnosis. Be treating symptoms while ignoring the real disease. You might be treating headache as a symptom, but that headache is not what is the problem. Maybe you are having hypertension. Another that self-medication will bring to you, it will cause drug resistance, especially if you're misusing this antibiotic, make bacteria stronger and harder to treat. So when you have you've been diagnosed with a particular disease which need antibiotic treatment, you will find that they're hard for you to get treated with antibiotic because you have misused these drugs. Another thing is overdose or side effects. Some people take drugs, they don't know side effects. They don't know even how the amount of they should take per day. Know things about that drug. So which means too much of drug or mixing medication can damage your liver, it can damage your kidney or even your heart. Sometimes you're taking something else and you're having another condition. Another thing is also masking serious illness. You're taking painkillers, you are thinking you will have stomachache will go. But do you know that you might have another disease? You're just masking the illness. You're not treating the illness. Risk. Some medications so addictive, so you find that it will lead you to medicine can be highly addictive if taken without a supervision or without prescription. Do you think people do so? Saying, why do you think people do self-medication? People do self-medication because of high medical cost, lack of access to healthcare, or even self-belief that they already know what is wrong with them. But the truth is, guessing with your health can backfire in dangerous ways. Good. What are the safer approach? Do instead always consult with your doctor. Let me tell you, if you go to these pharmacies around, you just tell them you want maybe say amoxicillin for prescription. They just tell because they want money. So you should consult with a pharmacist, consult with your doctor, consult with your nurse. Yeah, prescribe dose strictly. Don't overdose. Don't underdose. Using leftover or shared medications. A friend suffering from another disease, you think that you're also suffering from the same disease, so you're going to borrow or you're going to take the drugs that this person used. It is wrong. Call help if symptoms persist. For example, you have a headache today, you take painkiller, it goes. Tomorrow it comes again, you take painkiller, it goes. If you're doing that for a longer period of time, you're putting your life at risk. So instead of doing that, if you've taken that, let's say for example, you've taken that painkillers today or analgesics today, tomorrow the headache is not going or it is not reducing, kindly for medical help. Is too valuable to gamble with. Self-medication becomes self-destruction. If you found this video helpful, kindly, a friend, that if you found this video helpful, give it a thumb. Someone you need, someone who needs to hear this, and subscribe for more health tips like this.